Hi, my name is Ginger Robbie, and I'm a doctorate level behavior analyst here in Sioux Falls, South Dakota, and a service provider with a local organization. But today I wanted to take a minute to go through a paper that was recently released out of the Council of Autism Service Providers, or CASP. I found this paper to be particularly useful, thus I wanted to create a recording, hopefully to make it easy for anyone to be able to go back and review, look at this in detail. So basically, it is an executive summary and a detailed paper that goes through the treatment guidelines and the generally accepted standards of care for learners with autism. So really, in order to avoid an individualized recommendation or a recommendation that's based on your own personal beliefs or what has been happening in a community, it really is the case that all of us as clinicians, pediatricians, neurologists, if you will, should go to what has been shown to be effective. And so CASP did a particularly good job at creating generally accepted standards of care and treatment guidelines so that we could all go and look at what's been shown to be effective. The full paper is available on CASP's website, and I also can email anybody the paper. So it begins with an executive summary that really states that because of the fact that behavior analysis or applied behavior analysis called ABA is really a widely accepted treatment for autism. It's been recommended since 1999 by medical doctors, clinical psychologists, pediatric neurologists, and even the Surgeon General. So treatment should be individualized and really based on the research and best practices. Those diagnosed with ASD have many times co-occurring behavioral health and medical conditions, for example, like seizure disorders. And really the presence of these co-conditions is not a valid reason to deny or limit access to applied behavior analysis. And coverage of ABA should not be restricted to specific settings. It can be covered in any location where therapeutic benefits could be achieved. Coverage of ABA should not be excluded, denied, or limited based on the degree of parent participation. And in addition, it should not be limited based on age, nature, or scope, or the degree of ASD or the cognitive impairment. So first it goes through what is ASD? Really, autism spectrum disorder is a neurological developmental disorder defined in the DSM. It is characterized by varying degrees of difficulty in social communication and interaction, evidenced by various limitations in social emotional reciprocity, nonverbal communication, and relationships, and typically the presence of repetitive behavior and or restricted interests. So next, what is applied behavior analysis? Well, it's a well-developed scientific discipline that focuses on the analyzing, designing, implementing, and evaluating of social and environmental modifications in order to produce meaningful changes in human behavior. It's been proven to be effective across the lifespan, so all years of life, with hundreds of peer-reviewed studies over the past 50 years. It is the leading evidence-based validated treatment for ASD. The success of this treatment really has made it the standard for treating ASD, according to the American Academy of Pediatrics and the American Medical Association, or the AMA. So within this white paper, there's really great details about applied behavior analysis, so that one can be clear what are some options and what are you looking at in order to make sure that it is in fact applied behavior analysis. So first, it's who does it? Practitioners of ABA are called behavior analysts, and they're nationally credentialed such that they're BCBAs or BCBADs. And in South Dakota, we have state licensure. So South Dakota Licensed Behavior Analysts also are LBA. There's two numbers after the individual's name. There's a 1 dash and then two numbers. Those two numbers indicate how long that clinician has had that credential. So it gives the year. So if it says 1-14, that means they've been practicing since 2014. So within ASD, behavior analysts are able to implement a 2 or 3-tiered service delivery model. So there's a couple tiers of the service. It always involves intervention with the learner, and that is typically performed or is best performed by a registered behavior technician or an RBT. So an RBT does the one-to-one, and a BCBA does the supervision. Sometimes there's an assistant, and that's a 3-tier model. And tiered service delivery models were created to improve cost effectiveness and really increased access to the services. So within applied behavior analysis is recommended, medically necessary applied behavior analysis is what is recommended. The paper does start with going through definitions of medical necessity. So first it outlines, and you can pause the video to read this entire slide, but it outlines the medical necessity definition from the American Medical Association, in addition to the definition that's used by the American Academy of Pediatrics. Whereas both of them really do highlight that medical necessity is healthcare interventions that are evidence-based, evidence-informed, and based on a consensus advisory opinion. They are the intervention that is used to prevent, detect, diagnose, treat, and ameliorate the effects of a physical, genetic, congenital, developmental, behavioral, or mental condition, or injuries and disabilities. But in this way, the condition or the diagnosis is autism. So these definitions and requirements show up in state law. The insurance laws impose definitions of medical necessity, but because this is now deemed medically necessary, insurance does cover medically necessary applied behavior analysis. State Medicaid does have some different rules, but overall, ABA is indicated as medically necessary for learners diagnosed with ASD. So I want to go through a couple details real quick that are also there in this paper. So next, some details of ABA. First, it starts with treatment is guided by an assessment. There tends to be norm-referenced, criterion-referenced, and standardized assessments. And then there's the creation of an ITP, or an individualized treatment plan. The plan is a collaborative plan. In the plan, there's a detail of like acquisition, like how they would acquire new skills, maintenance, and generalization. In addition, in the plan, it gives details related to the number of intervention hours that are recommended, the number of supervision hours, and the duration of services. Some additional details. Some things as it relates to medically necessary ABA. Age should not be a determining factor. It should be clinical needs, not the age of the learner. ABA is effective across the lifespan, and it should occur as soon as possible after the diagnosis. So the earlier the screening, the earlier the assessment and diagnosis of autism, the earlier that we can begin treatment. And there's really, really good research and data that shows the earlier we begin, and the thing next, which is treatment intensity, is how we get really meaningful gains. So the scope of treatment is whether or not it's focused or comprehensive, which just means is there kind of one developmental domain or limited behaviors, or is there really pervasive developmental delays or across all 5 developmental domains, which is more comprehensive ABA. There's also treatment intensity. So within medical necessity, that is the intensity of services that it would allow us to achieve the treatment goals. It should not be, or it should be independent of outside activities or whether or not they can access it. And it's not related to exposure. If there's a conflict because the family's so busy or the child is so busy, medical necessity is paramount, and it should override or be the determining factor in kind of deciding on conflicts. So when it comes to treatment integrity, like I said, there's focused treatment. Focused treatment tends to be 10 to 25 hours of applied behavior analysis. This is one-to-one intervention with the RBT. Comprehensive treatment typically is all developmental domains. Really more behaviors tend to be involved in comprehensive treatment, and that is anywhere from 30 to 40 hours a week. But the best available evidence demonstrates that the intensity of treatment The dose essentially is the best predictor of achieving meaningful treatment outcomes. So this little figure shows that medically necessary or medical necessity applied behavior analysis can be implemented in the home, school, community, clinic or outpatient, residential, hospital, or inpatient. It can be across settings. There's also a consideration of treatment modality. Services can be in person in the home, in person in the center, telehealth, or a hybrid of services, and that's based on the individual characteristics. One other thing I already mentioned is treatment duration. There's no specific limit on the duration of services, but overall it's individualized. In addition, a major important part of medically necessary applied behavior analysis is really looking at progress over time, goal acquisition and outcomes. So as I mentioned, there's also intervention and supervision. The supervision, like how much supervision does a learner need, is a ratio to direct treatment. The best practice, the generally accepted standard of care, is 1 to 2 hours of supervision for 10 hours of intervention. Supervision is really what makes that high dose of intervention really effective. In addition, there really needs to be collaboration with the medical and the therapy team. And then one of the final things that's discussed in this paper, and it's really important, is that there's transition planning. Transition planning is how will the learner achieve their goals with their family, the learner and their family achieve the goals throughout the services and discharge. When will they be ready to, discontinue services or be done with services essentially? So this is the overview. I know it's a quick overview, maybe even longer than anybody wanted to listen, but hopefully you can rewind this, play it, connect with me if you have any questions. It's just so important and essential that we share what we know. And I found this paper, found it to be a great review of generally accepted standards of care and medical necessity as it relates to learners with ASD. So here's an email if you have any questions and/or our website. Thank you so much.